Now, we would like to continue with the presentations of the countries on the strategies for dissemination, implementation, and monitoring of dietary guidelines for Latin America and Caribbean countries. We will have the first presentation by Colombia, by Professor Zuma.
Muy buenos días para todos. Voy a compartir la pantalla.
Good morning to all. I will share my screen.
Buenos días. ¿Me pueden confirmar si me escuchan mejor?
Can you hear me?
Sí. Sí, buenos días. ¿Me escuchan mejor?
Good morning. Can you hear me?
Ok. Y acá ya estoy compartiendo la pantalla. Bueno, gracias a todos. Para Colombia, pues es muy importante poder
Thank you all.
nuestra experiencia.
It's important to be able to share our experience in the process of nutrition as regards such important points like the adaptations and editorials and the formalization of the food guides. That is one that we've been leading since the beginning, and the Ministry of Health and Social Protection. Firstly, I'd like to talk a little bit about what is this important data and which was the reference basis when we did the update of these dietary guidelines. An important point with the situation of the pandemic that we might have a more complex situation in the number of homes that have food insecurity, and was 54.2 in 2015, having been reduced in 3 points from the previous measure, but with an important call. Half of the homes had heavy or moderate. There's some important points here. And how much and this was important, 72%. And also you can see that fortunately the proportion of kids under 6 months that were being breastfed was 36.1%. Other important data are associated with where you had a constant reduction, 10.8%, and we've been working in different actions. And in contrast with that, a very big difficulty that many countries in the region have is the important increase in the overweight in all groups, age groups. And it is concerning in the children in school age, where it increased in a very big way. And 2 in 10 children show this condition. In 5 in 10 of each 10 adults is overweight or obesity. And in some specific areas, there was an increase from 2010 to 2015 with the prevalence, unfortunately, with deaths associated with malnutrition. We updated our dietary guidelines for those older than 2 years and those mothers, pregnant mothers, and those that are breastfeeding under 2 years old kids. and with different entities that are also associated to actions of nutritional education. And we are also developing new, also various tools that allows to approach this certain age, certain groups. For example, in 2019, we had a manual for nutrition or dietary guidelines directed to kids in school age. And we had a basis of these guides, technical documents, okay, manual for those who coordinators, food standards in exchange of groups that help. For the updating, we followed with a certain methodology, followed technically by FAO, with the methodology that they are promoting, that and which defines the way to update these guides to make the evaluation of the current state of those guidelines and need to update management of the information to update these guidelines and the scientific evidence of the situations and to define which would be these important messages that would be part of these guidelines for over and under 2-year-olds. We had workshop for technical construction, also a process for validation with the population so that this technical document, because we saw that this would compensate for the population and educational guides. So we did this initial review of those guidelines that the country had, that was from the year 2000, with prioritization of themes, with questions, with this nutritional situation of the country. And it was defined which would be these priority themes, so we could do the search and review of scientific evidence, and with workshops supported by specialists and also experts from the various entities that also allows the discussion so that we can get to this consensus in the evidence and then recommendations and messages here at the end in what would be the healthy dish of the Colombian family. This is the healthy dish of the Colombian family. This here we will communicate which are the food groups, what is the proportion of each, and should be included in daily meals. Besides the groups, we have here the cereals, tuberculosis, roots, vegetables, meats, sugars, but we have also water, something fundamental, and it's part of good nutrition and physical activity. So we promote a varied diet, the portions that are necessary during the day, and something fundamental which we've been working, which is to promote the consumption of fresh and natural food, and that is proper from the territory, and the preparations of each of those regions of the country, besides also the diversity that we know from other countries that Colombia has. Multiple regions, ethnic groups with their particularities. I would like to talk about the importance of physical activity and to promote family agriculture. As regards the center axis of the presentation, level of processing, sustainability, food culture, those food systems, and we also like to highlight these messages and new messages, but we emphasize those that are associated more to these themes where we have the idea of consuming varied and fresh food, as well as also milk, eggs, and other natural products, to eat them full with also fresh fruits and vegetables, and this should be part of your nutrition,
arveja y garbanzo. En el mensaje 6 está el de
and
mantener un peso saludable, reduciendo
lentil
los
and
alimentos
others.
refinados
Also,
que
to
también
keep a
hacen
healthy
parte de la
weight, to
particularidad
avoid packaged
del
products,
incremento tan importante del exceso de peso,
and this
reducir
important
el consumo de
increase in
alimentos
weight, and also
altamente
to
grasos y
reduce
especialmente altos en
any
sodio.
kind of
Esto solamente para que la tengan
canned
visual.
foods and others with high
Estos son los
sodium.
mensajes que tenemos
So,
incluidos
just
en
for
el
you to
Guideline.
see, there are many messages that are directed to women, women who are breastfeeding, who are pregnant, those under 2 years of age. So, these would be important informations that would have to be passed to these groups. In the case of boys and girls under 2, and these informations are important and should be considered to favor nutrition from fresh food, preparations that were done at home, and not to consume these processed foods, and to observe a healthy diet, reduce the consumption of sugar and salt, and to observe the characteristics and needs of each group. In the strategies of implementation and how to give publicity in these food guides or dietary guidelines, we have many ethnic groups in the country with a lot of diversities, different languages. So we did a work in the territories so we could generate tools that allow us to work directly with them so they these dietary guidelines can be recognized and the messages according to the need of each group. And with FAO last year, we were the community Mizaki and Bera Shami with those people who live in the land and the Pijao de Tolima indigenous group. There we worked with a lot of groups besides the implementation of a strategy that we also worked with FAO of education and communication and food and nutritional security with the participation in identifying the needs of each of these territories. This was a strategy that was built with these educational agents and that had allowed us every month to reach around 2 million people of boys and girls and their families. And from this, we were able to implement these dietary guidelines in all the actions that were developed and that had components of food, health, nutrition, and we offered 70% of the daily necessities, and these guides were taken the dietary guidelines as basis and are all in this component education and nutrition, which we are in this moment incorporating more guidelines and also incorporating of specialists. So these are the 6 steps that we have in this, where we have the identification, diagnostic of the needs. We want to change the identification of the audience to which it is directed, to define the tools, educational tools that are necessary to improve the process of education and generate channels of communication. Here are some examples of some of the toolkits we have. We have, for example, this was done with the same technique that I use with the indigenous. It's in Spanish, in Guayunaiki, to see the reality, to see breastfeeding. This is a practice in the population, and this is one of the populations that unfortunately was one of the most affected by malnutrition. Development, for example, pamphlets. Here would be the promotion of recipes, so to improve the complementary nutrition. We have many educational tools, over 40, and are available on the web, and which receives over 1,100 municipalities, and we are helping in the adoption of these guidelines. We also have some strategies through a site, a TV program, and a radio program where we reinforce the strategy, which we call
semana a semana se haga la actualización de diferentes herramientas educativas donde estamos
that allows
promoviendo
us
una
to update every
alimentación
day
saludable
and where we are
basada en
promoting
la
a
cultura de la
healthy
lactancia materna
nutrition
y
and the
educando
practice
en general la
of
población colombiana.
breastfeeding and helping
El
the
Ministerio
Colombian
de Salud y Protección
population.
Social también ha
So the
venido
Ministry of
apoyando
Health
el proceso de implementación de
and the
estos
Ministry of Health and Social Protection is also in the working and implementation of these guides. New infographics, videos, these are presented in social networks from the Ministry of Health also, and that this be done in construction with the social communication and directed to all moments in life. Also, we advance in one strategy for nutritional education and rural nutritional education. This was done by our intersectorial participation, and as regards the commitments that we have in terms of implementing these. And we have a system that gives progressive guarantee where one of the most important spectrums is the development of the strategic effort as regards the rural zones where all entities would have the idea of having the same technical direction or line, defining the behavior that we expect to change, objective groups, definition of the objectives, construction of messages, of channels of communication, actors, roles, reach, as in the process as regards the Ministry of Development. So, in this way, there are various advances that are important, like the document for support for the regulation of all the school cantinas, that they be healthy, that there be healthy nutrition, and that this be set up in the guidelines. We are also working in an alignment of promoting healthy nutrition and with a tool to establish healthy establishments like restaurants, like cantinas, supermarkets that would allow us to transmit the information that we have on these dietary guidelines. We had a concrete experience where one of the surfaces of the supermarket is putting in their gondolas messages that are directed to improve the nutrition of the Colombian population and reinforcing what is in the guidelines. And we're also working with the territorial directories and, and reinforcing the capabilities of the actors in health so that in the spaces where you have direct relationship with the population, you can share messages from our sanitary guidelines and implement their implementation from the resolution 3280 from 2018 with the idea of reaching the improvement of attitudes and practices and to promote an adequate nutritional situation to avoid diseases. We are also working in a coordinated way, and the Colombian study in a normative act with the resolution to adopt these dietary guidelines, be they over 2 years old or less under 2-year-olds, and where we are incorporating all of these tools that are being complemented and that we want to formalize as well. That's why we have the technical document, manual for the guides, and infographics.
In such a way that everybody who are into education health towards nutritional health and to promote a healthy food and diet have this normative backup to provide more strength to the implementation process of the dietary guides based on foods. And we are also working with the development of the dietary guides implementation plan that has a great effort on territorial pressures and to take that to specific communities. And we are planning the possibility of having an educational tools that would allow us to work with the population with any type of capacity that would allow us to bring well with to work with the counselors. We are starting to find these alternatives to work with them as well. So we have the visual capacities and low capacities. We are promoting the dietary guides through our educational agents. First, to have the target of training 600,040, um, and we just finished 43,000, and, and this group is very important for us. And while food and nutritional education projects that will allow us to promote the healthy food um, habits and with breastfeeding and many others. So, but the important thing is to strengthen the communication strategies towards a sustainable, healthy habit, and we are reducing the wasting, the food wasting, and we are working towards that to work with entities that deliver foods. Um, Around 1.8 million children receive food from our services, but we know they're wasting this type of food in such a way that we are defining this model to prevent and connect everybody, the education process with the prevention of losses and waste of food. That's what those are the advances that we have had in Colombia at this moment. That, like I said, we try to coordinate with the Ministry of Health in the Colombia Institute of Family Planning, creating this food security commission. Thank you very much. Thank you, Dr. Zuma, for your contributions and information with regard to the seminar. Now we'll have the presentation of Costa Rica and be hosted by Dr. Cecilia Gamboa. You have the floor, ma'am. Thank you very much. It is a great pleasure to be with you. Let me put up the presentation.
Vamos a ver si está. Está, ¿verdad? Está completa. Sí.
You
¿Se
see
ve
it?
bien?
Okay.
Muchas gracias.
Thank you.
Yo le voy a presentar las guías
I
alimentarias
will present the dietary guides based on foods in Costa Rica that we continue advancing. Oh, apologize.
Creo que. Ah, ya. Ahora sí.
There you
Yes.
go.
Ahora sí. Perdón.
Yes.
Okay.
Bueno, para comenzar,
Well, to start,
voy a mostrarles un poco
I will show you a bit of what is the epidemiological part. We,
el censo de peso y
according
obesidad
to the
del
census
2016, vemos
of
que el
2016, we
10%
see that
de la población venezolana
1.34% of the
ya
school
tiene
population,
sobrepeso y obesidad.
they are overweight or obese,
Rápidamente podemos ver que ya
and we
el
can see that in the
desnutrición
case
siempre
of
es
malnutrition,
bastante baja, es un 2%,
we it's around 2%, so quite low. And with regards to the
3.6%.
or the low height, we see
Ahora con relación a
33%. Well, now with regards,
podemos ver y
well,
notar
in
que
reality, we can
la
see
prevalencia de
that
sobrepeso y
the
obesidad ha tenido
prevalence
un incremento
of
en todos
overweighting
los grupos de edad,
has had an increase in all age groups. I can show you the adult population where we see
el grupo de 20 a
the
24 años de
the
mujeres
20 to 44 years of age for
como ha habido
women
incremento a lo largo de la
has had an increase
nutrición
in
desde 2008
the
hasta el
survey
2008-2009,
from 82 to
digamos,
2008 and 9,
34.6 pasó
from 34.6% up to 59.7%,
de las
and in the
mujeres
group
de
of women
45 a 64
from
años,
45 to 64,
porque como
It is more, even more alarming, as you can see, from 55.6 to 77.3%. So those are numbers, those are figures that are quite high. And in case of men, is a bit less. So we don't have data from 1982, but in 1996, so 22.1 to 63.4 in 2009. With regards to, well, to the foods, well, we're at this moment in a process of updating the dietary guides. As you'll see, that it's been 10 years since we started, and we started this process of analysis of the food, the nutritional guidelines. So we can see studies and surveys that and researches that what we're eating in excess in Costa Rica, we can see sugar and salt. In 1996 in 2006, we could see the source of energy of the teenagers was rice. In 2017, the sugary drinks are the main source of energy. In 2016, there was a survey where we saw that in urban areas, we determined that the consumption of energy from sugar was is 14.7%. So it's way above the WHO recommendation. With salt, the same thing. The consumption of salt in 2004 and 2005 was 9.7 grams per day per person. In 2013, was 11.5 grams per day per person. So we can see this is more than double what the WHO recommends. And now we highlight what what we're not eating enough. And here is important to show the beans, which is a culturally basic food for Costa Rica for all the benefits. And this consumption is decreasing, especially uh, in the urban areas. You can see the median of the population was 32.1 per gram, 22.1 grams per capita, one spoonful. And to highlight that fruits and vegetables, they don't even reach 50%. And and those are the data, the latest data, the 196 grams per day per person. And I'd like to speak about the history of the dietary guides. The first one was 1997, directed to nutritional education, and they talked about the nutrients towards the area of education. And in 2007, there was they updated uh, the technical alignment for the elaboration of the dietary guides, and with this was the starting point to the dietary guide. In 2011, there was a review, and those dietary guides have a view of a healthy population and had a focus of promotion to health. After 10 years, as I have mentioned, we made a decision to update this dietary guide to according to the epidemiological profiles that has had a great change where it can highlight there's a high prevalence of overweight and obesity, as you can see. So there is a focus that I want to mention that now in 2021, for the first time, we've had dietary guides based on foods for the first 1,000 days of life. And the former guides were for the people, for the children above 2 years of age. And now we're focusing on the families. And this was a great achievement. It's been a month since it's been launched, and it started being spread through the social network, the dietary guides, all this material that we have. It's beautiful, and it's on the website of our ministry to whoever wants to download it. Now, in the process of the dietary guides for the population above 2 years, we're in the middle of the process. Those dietary guides they focus on the food systems with this view overweight population. This methodology for the development of the dietary guides has used a proposal or an update of the methodological proposal of from FAO. And I want to highlight that throughout this whole process, we've had the technical support to FAO. We've had the technical support to FAO. And the process that we are showing is that we continuing for the dietary guides that have been published and they are being implemented. And we are also taking that to the uh, above 2 years of age dietary guides. And here you can see what we see the identification of the main issues in the construction of survey questions or research questions, and we reviewed all the scientific evidences, both nationally as well as internationally, to be able to have the whole in the document technical recommendations. And we're in this process to be able to reach that in the updates of these guidelines. And then a process that we prepared the draft, we're validating with experts. We have steering groups of experts towards uh, this guide for above 2 years of age, as we had for the ones below. And now we're starting to have these documents with messages that you will be able to validate with experts and then to follow the process that we did with the other guide of consultation meetings with different groups and different workshops to to have the consultations and validations. This was one of the first workshop that we've had at the end of 2019 when we started to study this methodology. We mapped the social stakeholders to start this dietary guide process. And here, well, we invited people who had to do with the food systems. And this is a picture because also started a process where we were aware that the dietary guides, well, the last ones that we had, well, they have a very strong component on the themes of nutrition and health. And we are aware that if we want to work with a focus on dietary systems, we need, or food system, we need to reach other hierarchies, other ministries, other important institutions to be able to work with this wide scope. And this is with the Ministry of Agriculture and Livestock, the Ministry of Agriculture, that have had many meetings and activities, and we had the representation of the civil society, and and FAO was with us during this process as well. And one of the things that we have been working in is that we need to create strategies and recommendations with the possible actions of not only having the consumer behavior, because the the message should not only to be to the consumers. Well, you need to have all the chain from the ministries and to see how this message is taken forth and all the recommendations to change and transform the food environment, which is something important, and to be able to have a changing behavior of the consumers. So this is one of the ways, those constructive ways that not only we want to create a recommendation strategy, but we want to include the possible actions. So it's not only to eat more food and more vegetables, no. Well, what to do is more what to do for that to be possible, to identify the possible actions. So this is an example of what we wanted to increase for because the population are eating 300 grams of fish per week. Well, we want that. So the idea is to increase the supply, and all the possible actions is to uh, provide funding for the purchase of fishing equipment to the small scale fishermen. And And the food environment, well, the strategy to provide mechanisms of social protection to guarantee that the most vulnerable people will be able to follow with the diet's guidelines. And one of the possible action that, well, we're reviewing the national policy of social protection and then the action plan to introduce a fish in the food chain in urban areas and areas deprived of social security. In the case of behavior, if you want to increase the knowledge and the skills of the people to buy, prepare, and consume fish, well, one of the actions is to develop this strategy of communication to promote the fish consumption. So this would be the methodology to be able to identify what we want for the groups and the possible actions that need to be carried out. Some of the next steps, well, as we saw, we have the dietary guides for children younger than 2. And now we're starting to develop the for children above 2 years of age with the messages elaborated and validated with a strategy of implementation and communication. And I want to mention that the previous guide, well, we have done a lot of work and a lot of graphic material, a lot of documentation, and a lot of many reports that have been spread, and a lot of training has also been held. It's mainly the to the sector of education and health, and we also sent that to several public institutions, but we're certain that we didn't reach much of the message didn't reach the population, in the target population especially, that which is the level of professionals in institution. Then this is something that we need to work, and we are aware this is very important, and something that we need to do is strategy of monitoring and assess and evaluation that we didn't do prior. The information was quite vague, and we are aware that if we want to advance and we want to have dietary guides that reach the different groups of people, we need to work on that. In the intersectorial commission, we need to have a wider commission where we'll involve the Ministry of Agriculture and Livestock, that is not a Ministry of Culture, as I said, civil society, and identifying other entities that should be there. And something important is to mobilize resources, because we are in this process. There's a lot of collaboration and constant follow-up of FAO, but we know that to have all the process and as we wanted to have, we need to mobilize more resources. The dietary guides, we have the Ministry of Health, and we see the Ministry of Public Education, the Science and Social Security, the University of Costa Rica in Cincinnati, in Ciencia, which is the Nutrition Research Institute. Thank you very much, and for your time, and we'll wait for the discussions to be able to answer your questions. Thank you.
Muito obrigado, doutora Cecília Gamboa.
Thank you very much, Mrs. Cecilia Gamboa. Any more things? And I try to be very, very punctual, very direct, so I wouldn't go over time. Thank you very much, Dr. Cecilia. We will now have the presentation of Ecuador by Dr. Gabriela Rosero. Hello, good morning. Thank you. I will now share my screen, and I will steal a few minutes from Dr. Gamboa, if there are some minutes left for me. Well, the Dietary Guidelines of Ecuador. Let's talk about the epidemiological panorama. Ecuador has a great challenge as regards malnutrition in the country. since we are facing these due to a deficit process of each child under 4 years has problems. We are the second country from the region. And in the case of overweight and obesity, in 3 of every 10 children, 3 of each 10 teenagers have overweight or obesity. 6 of each 10 adults have the same problem. As regards hunger, we can say that 1.5 million Ecuadorians are undernourished, and to have access to a healthy diet, it's $3.18 per day per person. So 18.2% of the Ecuadorian population cannot have a healthy diet. As regards labeling, where we alert those that are in red, that have a high level of sugar, sodium, and 47% of the population eats this kind of products that have red labels. And the consumptions of fibers is very low in the country, 10 grams of fiber at national level. And in all indicators were worsened due to the pandemic. The Dietary Guidelines of Ecuador, we were the second to last of the country of the region to set these up, and they were done between 2017 and 2018. We went through all of the methodology, and the spaces. First, there was a committee by 4 institutions that had voice and votes in all of the process of building, and also the following step for implementation. The same technique is a technical space and in which they were already part. Other government institutions, so civil society, other entities of international cooperation as well. This was an intersectorial space. Always that these groups set up the issue of security for over 2-year-olds. This was the objective of the guides, and after that we counted with technical recommendations based on those recommendations in terms of food and nutrition in the country, which I had already commented. And we had a construction of messages, of visual identity that went through 2 processes of validation. One was, in fact, at the national level. We worked in terms of the focal groups, also with teenagers, elderly, so that we might have good information. And the second validation, which was quicker, and we took on all these variables that I mentioned. So with that, we joined these to the guidelines that were launched at the end of 2018. Currently, we are in the stage of implementation of these dietary guidelines. These dietary guidelines of Ecuador are represented by this image, which is a wooden spoon, which is very common in Ecuadorian homes, and has 11 messages. Each of these messages can be identified with each segment of this image. So, what are the main recommendations of these dietary guidelines of Ecuador? We identified in 3 components. First is everything we should consume, everything that is within the spoon and is healthy. So 5 messages are directed to that. And then we have two messages of what we should avoid to avoid cardiovascular problems, ultra-processed, and sugary drinks. In third place, four messages to what we should do. So in these recommendations, the way we put these three components, all our messages, we have in first part the consumption, 5 specific message of which are the food groups. And we identified 4 food groups that identify that people can combine these foods in their daily meals, and this gives an idea of this circle that is within the spoon. Those at a higher level and lower is the quantity that should be consumed, that should be natural and varied foods. And obviously, all of these elements are based in the culture of our country and identify the various regions of the countries and foods. And the fifth message, which is the consumption of safe water. So these are 4 messages of what we have to do. First is to be focused on physical activities, or are the ones that people do the most in Ecuador. Another message is directed as well of eating foods that are specific of our country, eating in family with the objective that we might develop culinary skills that is being lost to the in the new generations, and to also bring back these traditional foods that are being lost. And as last message, to recognize the role of family agriculture and the fields of our country where the foods come from, and how we should support not only the economy of these small producers, but also of consumers. The last message is what we should avoid consuming. We have the red light for foods and B, those that are processed or ultra processed, and the foods that we should avoid that are outside the spoon, let's say, which are these ultra processed as well as food that has a lot of fat and sugar and salt. One of the graphs we used to show the population what is an ultra processed, we used an image here of the healthy spoon with the classification of the NOVA classifications. Everything that is within the spoon is healthy, and we're talking about natural foods and that are minimally processed and less salt and grease and fat. So that even though it's processed, it's still healthy. And when they went through an industrialization process, then we talk and additives, preservatives. So these are the ones to avoid. So we emphasize the ones inside the healthy spoon. So what is the strategy to give publicity to these guides? We've been using social networks, Twitter. Last year, we did a strategy that was stronger to promotion in the International Day of Nutrition. And how we give publicity to our guides. We have a strategic alliance with a supermarket. We activate in social networks as regards the guides for dietary guidelines in these supermarkets. Second, was the use of social networks, where we talk about the right to nutrition, and we talk to journalists and ex-Miss Ecuador, many people that were influenced a lot the country, and an activation of what are the dietary guidelines, and also the socialization in the by means of communication channels. And here I would like to show when we did the strategies with the supermarket, that when they consumed and buying products in the supermarket, they would find these messages where they sell ultra-processed products. Here, people in delicatessens, they could see these messages. This is photos of the campaign with public figures, influencers. And why we're showing this? In this campaign, we did the Twitter for the National Day, World Day for Nutrition, so that people could get these messages and know about these dietary guidelines, and to know that in this country we would do these on Tuesdays, which was there was a savings on pizzas. We wanted to change the pizza Tuesdays to Ecuador Tuesdays, where we would talk about these guidelines. So we did this as a tendency on Twitter, and we approached 500 people per day with these different Tuesdays in our country. Let's talk about the strategies for implementing these guidelines. We developed with a national plan for the implementation of these dietary guidelines. And this indicates what are the objectives to implement these guides in all the country, and we identified all of the actors, the role of each team, these peoples that come from all institutions and that had been participating in these technical committees. What is the strategic part? What lines of actions that would allow us to give publicity all of the messages of the guideline? What are the competencies? And all of this followed by an evaluation. All of these materials, everything that is in the plan, is also in the repository, in FAO, also in the page that is within the plan, where we identify the actions and competencies of the committee. The strategy of communication, we have a commercial name, which is the Healthy Spoon, and with these secondary characters, and each one of them with their own messages. And we developed these materials where and how this could be implemented with the population. And how to train them so that they can work as as coordinators, as guides. And since we started last year, and we've trained a lot of them. We have American games, a more dynamic games, and things we have to avoid, and safer things, and how many cups of water they're consuming per day, and how we should consume this water. And lastly, we generated videos, a presentation video, and the characters. These last messages that we developed, recipes, And all of this, we can find these on YouTube. And finally, and we developed this in the page of the Ministry of Education. And now we have this microsite. Unfortunately, this can only be used by students or teachers or people from the Ministry of Education. Now we give all the security keys for the Ministry of Health so that all of the population can have access to this site and these dietary guidelines. So what are future agendas? Our interest is to increase the number of guides for these guidelines with these platforms and the Ministry of Health, like I mentioned before. And it's in our interests to generate an exclusive page so that people can identify and finding some kind of material that can help and promote this nutritional education. We are now currently working in a campaign, a strategy campaign, like we did with the national implementation plan. We already have a timeline of the whole year, and we will do it at the national level. And finally, it's within our interest to elaborate these dietary guidelines for Ecuador directed to the first 1,000 days. That's it. It's a very quick summary and trying to be within my time slot. Thank you very much.
O microfone está fechado.
Uh,
Perdão, erro técnico aqui. Bom, agradecemos
well,
aqui a
I'd like to
participação da
thank the
Gabriela
presence of
novamente
Gabriela
com
Rosero,
todas essas
and
informações
with all the
sobre o
information
brasileiro,
that
enriquecendo mais ainda
the
a nossa
search
sociedade.
certainly
Temos agora a
enriched this seminar.
apresentação
We
do
now have the
México,
presentation
que será
from
realizada pela
Mexico that
doutora
will be
Rosária Ramos
done by
Alvarez.
Dr. Alvarez.
Hola, ¿cómo están? Buenos días. Voy a
Hello, good morning. Let me share my screen.
Bueno, voy a empezar con el panorama
I'll
epidemiológico.
start with an epidemiological overview of the country. Well, there's not a lot of difference compared to the other countries that have participated. Unfortunately, we have the same problem of overweight and obesity. And the group below, 5 years of age, was from 6.3 to 8.4. In while school children is the problem is 38.2%, and from 12 to 19 was 43.8% and 74.1 in adults. 8.6 million people live with diabetes in over 20 years of age live with diabetes in Mexico. So with regards to the consumption of food consumption, we have a low consumption, as you can see, of vegetables, of eggs, and meat, and compared with the products that are not recommendable, such as sugary drinks, and well, there is a high consumption in all age groups. While in the theme of breastfeeding, we've had an increase.
Aún sigue siendo muy bajo
Well,
por ciento de lactancia
we had an increase of this uh, this breastfeeding, but it's still below the national level intended. In the national research of nutrition, in the group of adults from 20 to 69 years of age, we see that 29% of the population is sedentary. With regard to food insecurity, half of the country has some level of food insecurity. And Mexico has published the dietary guides in 2015. Was the first time that we had those guides. That before we, we had our normatives, and the only thing that we had was an official guideline that dealt with the whole the all the guides. And in 2015, it was the first time that we published those guides. The objective is for all service providers, health service providers, and population in general, as was the method of elaboration that came from an expert committee that elaborated the proposal. In this committee was the National Institute of Public Health. In the public sector is also participating on that, the National Academia of Medicine. There was national, international experts. All this methodology, we saw evidences where you have drafts of meetings with different scientific articles, all the corrections and everything that we saw in the meetings and the committees are here as well. In those guides, there in there is a normative backup or support with the political constitution of the United States of Mexico, the general health law, and official guideline that for food health or health related to food. Rather, the content of the guides. Well, there are 9 chapters.
Algunos temas, como el
And
capítulo
then have different themes, such as chapter 2, which feeding the different steps of life. And so we talked about the guidelines. Well, the interpretation apologizes. The sound is breaking a little bit. Well, we have different groups and different steps of life. And here we included the portions, recommended portions, the physical activities, and the help of the state to keep this the nutrition and how to keep people healthy. In the last chapter is nutritional counseling. What are how those guides are elaborated? As I have mentioned, according to the epidemiological overview and focused to this overweight and obesity and malnutrition, we have this issue. The obesity is smaller, but we still have problems with malnutrition as well as breastfeeding. The other and the point approach those guides in the food culture, the physical activity, the nutritional labeling, and nutritional counseling. And this is the image that we guide to provide this guidance, which is a plate, and this plate shows all the food groups. The guides have 10 recommendations. There are general and practical recommendations that have been validated by experts in population. And what were the strategies? Well, just the National Institute of Public Health created a website that was managed by them. The site had 2 hot sites, one for health professionals and the other one for the population in general, where they could calculate their body fat index and to share the experiences and to see the guides. And there were leaflets. And at this moment, this website is under update. And also in the part of the strategies of implementation, they elaborated materials and created campaigns, health campaigns. And we had alignment for the sales and preparation for the school feeding. And the last update that took place they were linked to those guides. And with those guides, we also supported all the actions of for the health professionals for them to use in all training, and this is to be replicated with the population in general. Well, now we are fortunately doing this update of the guides and the status of the development process. This is being done in 3 phases. We had this explanation to the committees. We had the academia, the National Public Health Institutes, the collegiate institutes, and with situational assessment, and they established the objectives of this process, of this work group. Apologies. And, so we're in the technical drafting of this group, and we're updating and changing some of them. And there's an analysis of the diet, and it's important to highlight here that in this update we are considering that we're going to implement or consider the theme of the environmental impact as well. And we have different objectives in the development of those guidelines. And there was also the validation. Well, there was a questionnaire, an online questionnaire. Unfortunately, well, we were not able to reach all the population, or at least the vulnerable population, due to the pandemic. And so, just like this, it was done online only. So the validation of those researchers. So we are under review of those messages. And as you can see here in the last phases, that we see this normative and the changes of the norm 03 in the north, center, south, because we want to have all that. But we are talking about the same thing, but in a different way. We are working for everything to be aligned to the guides, to the basic guidelines, and to the food health norms.
Y bueno, estos son de
Well,
nuestra agenda.
Those are next steps to include exclusive breastfeeding for the first 6 months, and together with healthy food, and to decrease the consumption of the animal product, especially meat. In those days, we have been discussing the amount that we should recommend, and to have analysis of the consumption of how much meat they have been consuming, and to have this recommendation together with the last recommendation from the Lancet journal. And we're going to increase the cereals and seeds, and we're going to increase the theme of ultra processed foods. And because in Mexico now we have with this new front label, so now we're going to include all those different label guidelines in the prescription of local consumption. We're including this theme of environment, such as the use of plastics, the decrease of the use of plastics, and food waste. That's what I wanted to bring. Thank you very much.
Muito obrigado, doutora Zaira Valderrama.
Thank you, Dr. Valderrama. We have now the presentation from Uruguay that will be held by Dr. Jimena. Good morning to you all. I'm very happy to be able to be with you today. And before starting my presentation, I just want to congratulate the organization and the previous presenters for the amazing work carried out. Let me share my screen. for me to start with my presentation. Well, well, starting with the epidemiological part, the epidemiological situation of Uruguay is not very different from what we've seen in the other countries with regards to the prevalence and anemia of anemia. We have the issue with these children, and what are every three kids where one has anemia. We don't have the high levels of, well, but there was a problem of growth in the first childhood that affects 6% of our children. With regards to the breastfeeding rates, we saw this rate into 6 months. Well, we don't have a number that is too inadequate. Nevertheless, what we see is the beginning of the breastfeeding in the first month has decreased. In the beginning of the maternity, the rate of breastfeeding in the first month. So, but we still need to work a lot in those issues. With regards to food security, we have measured in the population in the first childhood in the national level, and we see the total population is 56% of the place with children below 5 years of age. They have food insecurity, and some 20% as moderate, and five severe. So those changes when we observe the population of the all the different uh, incomes. So the biggest issue is the overweight, obesity, and the non-communicable diseases. We saw in the previous days. So we have detected that 65% of the adults in Uruguay have uh, are overweight or obese. This implicated in an increase of 8 percentage points compared to the previous survey. On teenagers, the last or the penultimate edition of the uh, WHO saw 8% of obesity, and we we're about to see the latest results this that shows an increase of around 10 percentage points of the prevalence of obesity, but nevertheless, it hasn't been published yet. For children below 4 years of age, we have some 12% of overweight and obesity. And in school age, a recent data an assessment that was held in 2019 of the school feeding program that has a great coverage in our country has detected that 4 out of 10 children in school age they are overweight or obesity, which is quite concerning, really. And this is linked to the change in the ways of eating in the population, the institution of natural foods and homemade foods. We have ultra processed foods, and the study held by the Pan American Health Organization and regional level have detected that the purchase of sugary and ultra processed foods has increased in a very dramatic way. And Uruguay is the country that is in the blue line. I don't know if you can see. And we saw in the study, Uruguay was one of the highest consumption, but has a growing trend in the previous year in the consumption of ultra processed foods in Uruguay. This has doubled, and the ultra processed consumption has tripled, in fact. And so, in learning a lot from the Brazilian experience, the NOVA classification that for us was was a very important issue to change the paradigms. In So it was great to see some themes that we saw here that we weren't able to classify the industrialized food. So all the products that went to not we want to stop stimulating. I mean, we want to stop them from being overly consumed in the incorporation process in the dietary guides. Some other data with regards to that that confirm this increase of consumption of ultra processed foods. Here we have data of this very study with school age children, where UNICEF made a publication that shows us that percentage of what is consumed from these children, uh, and this every day, and students in the public schools. Well, we noticed that practically 30%, and well, and very close to 30% to the bigger children, or 30% of the calories consumed by these children came from ultra processed foods, or ultra processed food products. In terms of sugar consumption, in this study, this has shown that the children double that, near 100 grams of free sugar, which is double for the recommendation of the adult population, and 73% of the sugar consumed by the children came from ultra processed foods. In the case of sodium, 90% of the children would consume above the daily consumption, daily intake recommended by the World Health Organization. And all the sodium they consumed are coming from ultra processed foods, and some 30% in the processed foods. So in the case of the fats, some 32% of the intake of the fat intakes comes from ultra processed food. This is the most recent data that we have, and it shows the situation with regards to those topics.
Let's go to the next one. I won't share some of the screens because it's not, the presentation isn't running here. Sorry.
Bueno, la tecnología nunca me acompaña, parece.
No te preocupes, es parte de lo que vivimos todos los días.
Don't worry, it's part of life. Greetings from Mexico.
No puedo ni siquiera salir, algo sucedió. No sé si quieren hacer otra parte del debate.
I don't know, you do something. I might, if you want to do any questions. I'm trying to do my presentation. Okay. Can you see my presentation? Can you see it? Okay. So I'll share my screen once more. Apologies again. So our first dietary guidelines with this information, and in 2015 we started the updating, and it was an important change in what would be the epidemiological situation. So in 2015 we updated, and we can see the two icons that have these great differences. And we consider the methodology of FAO and validated by INCAPI. And the consultant Erika Mogina, which had supported Uruguay due to FAO in the first guide, but they analyzed, and also from other countries, Chile, US, but especially Brazil. We had the pleasure of doing consultations, contributions, and Fabio Gomes as well. And they helped us to increase this methodology set up by FAO, some components that were clear for us. So we took on the model of FAO, we adequated it, adjusted it. Of course, we started with the planning of the work, doing interinstitutional groups. I don't know if you can see it. I put all the participants from different institutions, from the academia, civil society. It was very ample, but once this group was set, we defined objectives and the principles, which were conceptual. And we were enchanted with the Brazilian guidelines, and to have the opportunity to have this more integrated, more holistic view that responded to the needs that Uruguay had. After this, we did a process of characterization of the population. We took technical notes, and we prioritized important points in terms of these guides in what would be overweight and what would be the non-communicable diseases. We saw what was available as regards what would be nutrition and what we desired to talk about, and we saw the first technical recommendations translated into the preliminary messages we wanted, and validations. To do this validation, different methodologies. In quantitative, we combine research online, an ample coverage of what would be the access to the internet, to technical devices, and as well as realization of focal groups with populations of different socioeconomic levels. With these proposals and seeing the initial proposals and this icon of showing the idea that we have of the integrality. The focal groups, the qualitative methods of what would be the comprehension, those that will ease the process. And one of the great debates, of course, was the incorporation of new and as what would be ultra-processed. That was 2015. And now I think it's more incorporated in our normal language. But there was a great uncertainty. We did some field tests, and this was one of the points where we questions, and we saw that the population clearly didn't know what would be ultra-processed. When we asked them to classify what would be those foods that would be within that, and people knew what we were talking about. So we got to the decision of effectively this guide would incorporate in the new classification. This was publicized in the end of December. And these are the main principles, conceptual principles, that each of these messages have this aspect. So we have a principle that shows that adequate nutrition should be considered a paradigm of human rights, that this guide should be adapted to new times, because we talked about how these dietary guidelines should be directed to the healthy population. But what population are we talking about when we have 7 in 10 Uruguayans are overweight? We should recognize that it is a consumption of nutrients, and this paradigm between healthy elements, nutrients, and others, and how it influences the results of the health, and that we should value homemade food, culinary traditions that are part of our culture and based on natural foods and very little processed, and the Brazilian guide. And we try to put an eye in the nutrition system and how food should be in harmony with biodiversity and sustainability of the environment. This was something wasn't very much promoted in our guide, and we also put physical activity as very necessary as a healthy diet. And we worked everything between, and we worked in a joint way. Uruguay has a guide of physical activities for the population, and each of these capacity trainings were done in that way. I can't believe, oh, it's locking up again. So, this is the publication. Like you can see, it is in the stage that shows the idea of healthy food, which is different, and this caused some surprise. When you talk about healthy food, soup, a typical Uruguayan, but it wasn't fish with salad. Here we have the icon, and we try to incorporate this view of natural foods and what would be ultra-processed and not as childish, because it would have to be considered a guide for all of the population and not only children. And we had a point to observe and incorporate other aspects that was not only the food. And around this figure, we have to see what has to do with the buying of food, with physical activity. The messages are divided. It's 11 messages of a scheme of style of food that were key and on your day-to-day, and to show specific changes that Uruguayans should do. We want to make good use of the food, and message two, to base your meals on natural foods and avoid consumption of ultra-processed and those with a lot of fat and sugar or salt. And to value our culinary traditions, and we invited the population to be critical with information and the messages they receive as regards nutrition. And this message, which was the hardest, we had to go over many barriers to incorporate this, because the industry mobilized when we were creating the guide, and finally it was included. Many information was included by the ministry to observe the foods based on natural foods and to avoid the ultra-processed with excessive fat, salt. And then you see clear examples that helped us a lot in this comprehension of what would be the classification with different types of products, there are comparisons or
Es que nos ha
a
funcionado
comparison of what each food adds, and this worked a lot for us. It worked very well. As regards strategies to give more publicity, I like to say that the guidelines were very well received by the population. When it was published, there was a lot of media coverage. But before the pandemic, because everything changed, the world changed before the pandemic. Now I don't know anymore. I would have to consult the document from the state that was downloaded the most. This was our dietary guideline. This was the reason to be proud for us. First, we did, like we told you, for capacity building. It has a very ample scope, instructions for those who participate. And the first that we did was the multipliers of these trainers that have been going through this process. And then we did multipliers for all of the institutions that do this, who are part of this integrated health system, as an idea of multiplying these trainings and knowledge and follow-up. And we created multiple workshops. The numbers for you might not be very impressive, but for Uruguay, this was a very big coverage. And in capacity building, in the trainings, we delivered 2 multipliers. This change, this set, which would be to promote the change to a healthier, shared, that is pleasurable. We counted with the help of UNICEF and FAO, and we had the pleasure of working with these guidelines. And this set, what does it do? It gives you practical tools, methodologies, so ways to transmit the message, and is set up less barriers, more commitment with change of behavior. And each of the units has a message. We see a message, for example, to cook your own food is good for your health. And there is a summary of the message of why, and then it talks about the barriers. What are the barriers in order to set up these messages or to validate these messages? The methodological suggestions, like practical activities to work this message, and to establish a commitment for change. This set also had a good repercussion because besides this book, there were cards, pamphlets, packages, fictitious packages of foods, many exercises to be done, simulation of quantities of salt and sugar. This was very interesting. This had a big repercussion. Unfortunately, we don't have that anymore, but it had a good acceptance. And the publicity was also supported, a summary that talks about healthy food, of each of the messages. And thankfully, Uruguay was established a time destined for the institutions of the state transmit promotional campaigns, and we had to put in the massive means of communication, not for a long time, but with a lot of good impact that had a lot of messages, but did the link and preparing the terrain for what is the arrival of the labeling in front of packages. Sometimes we talk about it has to do with commerce, homemade. One talks about introducing fish, vegetables, and reducing processed meats. The third, water versus sugary drinks. And the fourth, that put on the table, but it has to do with child nutrition and the excuses that we sometimes have to do those. And also elaborated materials directed to students that talked about snacks, recipes, manuals for cantinas. A second campaign was done which had the objective of giving impulse the kitchen, and we had the participation. Uruguay is very much into soccer, like yourselves. So the coach of the Uruguayan soccer team, he would ask for recipes in terms of taking back or saving those culinary traditions. As regards the implementation, we followed a implementation stage. We have a lei, the law that is the normative landmark to establish healthy nutrition in education centers, and we designed a strategy that talks about prevention as regards obesity in childhood, 7 practices for healthy nutrition in the educational context, and we advanced these at the end of the year. Of course, due to the pandemic, it was a little bit hard, the implementation, but this is a strategy that in certain way we understood that would help us to give the step between to go over and constitute a tool, educational tool only, and to do a political alignment, a specific practice in that sense, and the strategies that are very integrated, talk about in terms of food, and the second practice, which refers to integrate the contents in a transversal manner of offering healthy food, to connect students to the preparation of food, and to connect them to the cultivation of food. And the last, which has to do with physical activities. So this is a strategy that supported on these guidelines, and we understand that those will help us to give this qualitative improvement. So this front labeling, we have a message that says to avoid the consumption of ultra-processed food due to the excessive consumption of sugar and salt. So what is the main tool? In some way, it would be the way where we change, we do, so that the population, that it might be easier to take on these recommendations. And like you know, in 2018, it was published in our public diary or newspaper, and this set up 18 months to adapt to the front labels on foods.
And that had the saturated fats, and we have some had lists, and this decree started to be applied on February the 1st of 2021, and we saw these as the criteria for this in the assessment. Well, starting in 2020, we saw results because there are some companies applying that, and we've seen very good results in terms of the very interpretation of the information, just like the changes in the associations and associations by people. Well, future steps, next steps. The Ministry of Health in the law of the healthy food law and the competencies of establishing the list of recommended foods to promote adequate feeding, and this is done from Ordinance 116 of 2014. This law came prior to this Dietary Guide, and we implemented the selection of food groups that you see that we already attempted to include this NOVA classification, and it was quite hard to implement this normative since we didn't have any tools like the front labeling to be able to determine what are the foods that and what can be shown in the labels and so we are waiting for the ministerial approval, a new ordinance that include the front labeling of foods that so that will come with the food guide. And, according to the level of processing, and that will have this dietary guidance or guideline, well, according to that. So now we'll continue having three groups of food represented. Now we have the natural or minimally processed foods in group two, in the NOVA classification that we need to adequate to what are the products that may be in the cafeterias, and there's also homemade preparations with the recommended ingredients, and the group 10, which will be the ultra processed foods that do not contain the excess of all the nutrients the according to the recommendations of the dietary guides. And our biggest challenge is to transcend, to go from educational and to have that as a public policy alignment. We have a tool that we must use much more, and this is the line that we want to follow in the nutrition area in the ministry. And we have the tools, which is the creation of a national council that coordinates the policies to fight obesity. The Ministry of Health takes it forward and incorporates a series of institutions of ministries and other public institutions that has links to the theme. In Article 5 of the creation of the council, they have the dispositions of what and how the council will work, and it has been said that the competences of the council to provide the Uruguayan population with a with these public health. So our objective is to develop that, and as our biggest challenge is this, and thank you very much for your attention. And certainly we'll learn a lot from your experience. Thank you very much. I hope I didn't go too much over the time due to interruptions. Congratulations to Dr. Jimena from Uruguay, as well as the other countries that have contributed with the information in this first moment of our seminar. Now, to lead the debate in the seminar, we'd like to invite Dr. Gisele Bortolini, Coordinator General of Food and Nutrition of the Ministry of Health in Brazil. Before passing the floor to her, we kindly ask you all who wants to have contributions to include that on chat or click on the icon raise hand in the button reactions right below your screen. With the floor, Dr. Giselle. Thank you. I'd like to thank you for the excellent presentations we've had from Colombia, Costa Rica, Ecuador, Mexico, and Uruguay. Congratulations. It is very interesting to get to know the experiences of countries and to say that, well, we'll have here Paraguay, Bolivia, Peru, who are invited to participate in this network. As I have mentioned yesterday, it is an open network. So to participate here, you just need to formalize an email from the International Advisory of your country to the International Advisory of the Ministry of Health to support us in this large debate. We have the countries of or Portuguese speaking countries in which with which the country Brazil will have different activities in next year, and we have as members of this network we have Canada that unfortunately had the issues and was they were not able to be with us in this meeting, but certainly will join the group in the next meetings. Well, we have a couple of specific questions to each of the countries, but before I would like to hear a bit Zuma, Cecilia, Gabriela, Zaira, and Jimena. Well, in some, what are the challenges that you observe in the implementation of the dietary guides in your countries? And what challenges you you feel that well to take the dietary guides, which is well, like Jimena said, that to transcend the objective of the guide, which is to educate, but for the guide to lead other policies. So if you could speak a bit how this meeting, as in this meeting, we decided to talk about strategies of implementation. Well, we observed that several countries, well, there are great strategies that are common to all of them, but it was possible to identify some different experiences in the countries that I thought it was quite interesting. And I hope we have the opportunity to be able to get to know in detail. So Zuma, Cecilia, Gabriela, Jimena, if you all could talk about the challenges you see for your country in the spread of this guide, for it to be known by everybody in the countries, and how you see which is possible to overcome, what is possible to overcome, and how to overcome these challenges, and to have the guide to help all the policies in your countries. We can start. We can use the order of presentation. Zuma, are you in still? Zuma? Oh, perhaps not. Cecilia from Costa Rica. Cecilia, I know she's here with us. Yes, I'm here. Thank you very much. Well, it's great. We, as I have mentioned, we did well. The great challenge is to reach the population, and in fact, we are working. We are aware, as I mentioned, we're looking for strategies to be able to achieve a better disclose of the guides, and for that, it is important to have strategic alliances with other institutions, with other sectors, to be able to have a more systematic communication plan. When we were talking about, well, of course, I didn't go into details to the food list because they're very similar to the other countries. Yet, there's, well, we need to involve the other sectors. Well, that see these food guides that they are part of the other ministries and the other sectors. Well, it's not only health and nutrition, because many times are the guides or the guides were seen like that. So we see the importance of having those alliances, and this is part of what we're doing, this intersectorial, interinstitutional alliance. And we work with the civil society. We are creating a strong civil society on this thing, that we are working on that in other commissions to see, because, well, this has been key in many other countries. So to have a civil society that is solid, that provides that are part in the in this fight, as the civil society in Mexico and other countries, we see they collaborate a lot, and sometimes we're only in the institutional part. So it is and a great challenge, and it's key for me if we want to reach further, because the economical resources is certainly one of the themes, but we need to find a strategy to find resources from other sectors. That's what I wanted to add. Thank you very much for your question. Really, thank you, Cecilia. Gabriela, certainly, Isela. Well, I fully agree with Cecilia. Well, I believe the first challenge is the coordination and empowerment, institutional empowerment rather, to be able to implement the dietary guidelines. And besides the effort in Ecuador that the Ministry of Health has done with the Ministry of Education, those are the main institutions that have been working on that sense. Nevertheless, we see in other government institutions uh, the discussion about empowerment. And well, this guidelines did not belong to an institution, but to a country. So this is the one challenge, the first challenge. Each sector, each institution to feel empowered and to use these guidelines, and as well as the stakeholders in general. We see other international cooperation agencies. Some of them use it and others don't, and that's what is missing. Another theme that is very important is this theme of the economic resources in each institution in whatever sector. When we talk about those resources, and now, for instance, in well, we could see the private sector. We want to involve them, the private sector. So we have large supermarket companies, and so there are ways to have other players to add resources, and this is what we need to search and articulate. And another theme is that if we need to find different ways to spread the word, not only the social networks. We have the hot sites used, but we still need, although we are on TV and but we need to be in government areas and to use this theme of of influence, because the influencers helped very much. But we need to have like the World Food Day, and the guides need to be everywhere to be able to reach everybody, and we need strategies we need to reach places where you don't have good internet connectivity. Eh, Thank you. Gabriela, Zaira. Hey,
Pues coincidimos, Giselle.
well,
Creo que el trabajo intersectorial
I
es
believe this
fundamental
intersectorial
para
work is
la
very
cobertura de
important
la población
for
indígena
us
en
to reach
México.
most of the
En
population.
México, en México creo
But in
que
case of
vamos a
Mexico,
tomar la experiencia con
we're
otras
going to
políticas
take the
públicas,
experiences
como
of
las
other
políticas
public
alimenticias,
policies and other
el
strategies,
etiquetado o como
such
el
as
impuesto al
the
refresco.
labeling and the tax on sugary drinks.
Y se pudo llegar a
And
varias partes
we
de
need
la
to reach
población
different
porque
areas of the
las
population,
organizaciones
because
civiles
civil organizations,
tuvieron este impulso para
they
hacer
had
esta
this
difusión,
boost
tuvieron varias
to spread the
estrategias
word. There were different strategies. So now
multisectorial para
we
que
have this multi-sectorial committee
a
to
trabajar
the
con ellos.
guidelines, and we are working with
Esta es
them.
una
And this is a
estrategia que se
good
puede
action, good
implementar,
strategy to be
vinculando no
implemented,
únicamente con
to
las
link
dependencias de
not
gobierno,
only
sino
with the government
las
agencies,
instituciones
but
también son muy
with
importantes.
the civil organizations are definitely very important. Well, I believe, as Gabriela and Zara have mentioned, the guide belongs to the country, and everybody must use them. Jimena?
Bueno, estoy sumamente de acuerdo con todo lo dicho.
I fully agree with everybody,
Desafío de
and I believe the
poder
challenge
trabajar de forma intersectorial. Nosotros lo
is to work sectorially. I mean, we we believe we want the group to be the widest possible, to leave this guide that those to leave this idea that the dietary guides are only belong to the nutritionists. We understand, we know that, and we understand the relevance. But for other players, for other professionals, they are just another in a world where you have so many so much flow of information. We're hyper informed. So every time we get messages on food and on different types of it, and given the relevance the guide has, perhaps it's not easy to understand when you do not participate in the process or you don't have a previous experience on what does a guide implicates. Well, there are many guides. I mean, it, but in reality, this is what proposes us. So there is another. I mean, there's just it's just another handbook. So we need to think about intersectoriality and to have other disciplines together with us to be cross-cutting. We always need more. We can improve, and this is one of the points. The participation of the civil society feels fundamental. In Uruguay, didn't have this strong civil society on this theme, and I believe there's a regional process that is strengthening the voices of civil society. That Uruguay, we start to notice what we, especially well, we saw that with the front label and the other themes to start working. Likewise, the theme of the resources. It is very difficult to assess at all time because at all times we see messages that go against our message, and sometimes we don't have enough resource to have a massive campaign. But well, we need to put that into mass media, and 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 we need to democratize the access. Nevertheless, there is a sector of the population that if you're not uh, on TV, you don't get there. If it's not on prime time, the channels are not open. So there is well, unlawful competition, and we need to have other policies. We need to have the regulation of advertisement, and it is very hard for this dietary guide to be adopted. It's not impossible, but it's still we are at disadvantage. We know the industry invests millions and millions of food to promote one type of food, and we need to undo all that implicates a shift in paradigm in feeding. And in our case, we have to do that with very few resources. And the truth is, we count on the support of international cooperation
that allowed us to create materials, things that generated a lot of interest. Without stable resources, it's kind of hard. And another thing that I find is important is the importance of the chip information is information is more instantaneous in apps and sites, in the ways which we transmit information, because the new generations they work in a different way, they're more instantaneous. And to get to this, that would be that. Thank you very much. We had two questions. We can do a round of questions. One question was in the countries, there's a report on the benefits of using these guides. And also, if Argentina or they want to comment as well. In what kind of investigation strategies could be used to evaluate the impact of these guides? I think this is a very challenging theme for Brazil. It's something we want to advance, how to implement for truly and this guide. And we could do some quick comments, even if it's to say that it is a challenge and we have to think about it. Cecilia, please.
Bueno, vamos a ver si capté bien lo que a la pregunta.
Well, let's see if I got it right. I believe that this question that was done.
Correcto.
Okay, evaluation of the dietary guideline. From that, I want to say, I want to take note of that on my presentation, that there's a great lack or gap there, because in the most cases, we know we do a good work, a nice material, to do the follow-up and to do a real follow-up. But someone talked about the impact. We know about the benefits these guides have when you're doing capacity building or groups. The means of communication help a lot because they do the publicity when you're talking about the diseases and non-communicable diseases in terms of to these guides and in order to increase knowledge. What impacts would this guide have? I wouldn't say that the country had or made an evaluation of impact and how they were diffused in the publicity when people were included, people who liked these messages, but to really have, like we took down, a way to advertise this, to seek a mechanism that I think we have to work on and that it is important as regards this network that was set up with the experiences that we have, seeking the experience of other countries, countries that had more advances, but how to evaluate this and how to know what things are we working well. We're not seeing something well. We're doing just more of the same that might be repetitive. Maybe we should seek new strategies. That's why I like the question. We took over. And when you know, people know that eating vegetables and fruits is a benefit, but why aren't they doing? For which reasons? Which strategies do we have to do so that people might have access to this? If this is the price, how to do these to get this message to the population? That's why I believe in the work, the transformation, and that these be sustainable and those commerce, how they might have less intermediates, and to the consumers. If we are not able to do that, I would like to mention that I didn't say it due to the time. We're doing this with dialogue of systems in all parts of the system, like I mentioned, to see for this updating, because we have to do different things. We know we have to transform these nutrition systems if we want this food to be received fresher and more natural to the people's tables. Thank you very much. Thank you, Cecilia Gabriela. Thank you, Gisele. So it's a complicated question in how to do follow-up and evaluation, especially because we did this national plan for dietary guidelines to put indicators to be able to evaluate this implementation, and this helped us a lot. However, since the beginning, it's almost 2 years in the system of implementation. This national plan, etc. And since the last year, we were asking for numbers, statistics, and to see how many moderators we have, and the rest is really hard. The pandemic really got in the way. We cannot reach these places. And in order to offer these guidelines to the population, I could say, and we're doing a pilot project on the coast of the country where we're working in a very strong way with the Ministry of Agriculture, Ministry of Health as well, as regards nutrition, education, and also as regards school gardens and we're working with the Ministry of Education directly with this microsite where we have people who help. So the Ministry of Education have they have in the curriculum these. We can say we have an organic law since last year. And these laws already mention these guidelines, there's norms, and they give us more space. So what we're doing now is that these dietary guidelines be in the school curriculum, so all students, all the years, that their education be based on Ecuador's nutrition guidelines, together with the inputs that are being delivered with the Ministry of Health that will start to implement in the territory all of the recommendations in the Ministry of Agriculture, everything that has to do with these school gardens. We can say that from here that we are starting in a year we would have numbers that we could evaluate. In one location, we're talking about 40,000 students population. This is a theme for a step-by-step, and yes, we need a theme of support. What is academia? What is civil society? To how we could do the evaluation. And that's the one I'd like to collaborate. Thank you very much.
Sí, creo que es el talón de Aquiles de todos, ¿no? La evaluación, el
I
monitoreo.
think this is our Achilles heels, monitoring, and how Cecilia mentioned, I think we have very well detected with the materials and as regards the themes that are missing. We from Mexico, these were not evaluated, but in this update, yes, we are considering these processes with the follow-up. And one of the themes is that we only put environmental indicators and to include these, but we're considering this for the new update to have the follow-up. Thank you, Jimena. I'm in agreement with what was said. No doubt, it is the Achilles heels as regards to what was set up in Latin America and how the implementation of these guidelines were set up. It shows that the follow-up and evaluation, especially of impact, was the Achilles heels of these dietary guidelines. The evaluation of the process, the materials, even the implementation of other public policies. I think we could get there. And the evaluation of impact, and at least is something we don't have very much clarity in how we can implement and how to separate what is the evaluation of impact of these guidelines. And I think it's a little bit complex. Public discourse of communication. I think that São Paulo that gave us introduction of this theme in the agenda, and these questions show how these guidelines have penetration, but the impact they have in changing some health indicators is a little bit more complex. I think that with this network, this could be a point of contribution, of work for the development of methodologies that help us to evaluate the impact of these dietary guidelines. I think this would be an important contribution, and all countries learning with one another, and this would be very good. But we don't have very much to collaborate. We don't have these guides. We're still in a process of implementation, and we have a long path ahead. And we have other comments here, but I'm just going to comment very quickly that Patricia, that we did not have success due to the increase in overweight. I think this is a great debate. We know that there are various factors, and we know that you need a series of interventions to revert this scenario. When the country shows what are the standards of nutrition that can increase, and that has been used by all sectors, which is the great challenge. And from the production of food of the country be set up by the guidelines and the distribution, this would give strength to these guidelines for the population to put in practice these recommendations that food has to be produced in the country, has to be available in the country in an accessible way near people's homes. So that's why the great challenges of these is that they be able to induce public policies. And just to finish our discussion, I'm going to do two questions for teacher Hugani. She's a specialist in Brazil, and she helped us in creating this guide. And I would like to take advantage of her presence here and to say that soon after, we will have a meeting with people of the region so we can close the next steps. But I would like that Professor Inez could highlight what does she think are the main points that have to be considered, since various countries are elaborating these guides, some of them for children or for under 2, and for the countries that already have these guides, what are the strategies are interesting to use? Professor Inez, could you comment? Thank you, Gisele, for the opportunity. In terms of the strategies of investigation, it's a great challenge. It's something we should continue to talk about, to imagine what do we expect as an impact of these guides, like you mentioned, in terms of the synergic and complementary measures, and to orient our process, be it in implementation or in impact. So as regards development, I would like to highlight the following points. Like many countries made explicit the importance of guaranteeing the presence, the interest. And another important thing, this also showed up, but with nuances of guaranteeing space where people can be heard from different actors, not only actors, but the activists, and to hear the families to whom we direct. It's during the process, not only when we validate the process, to see what are the demands they have in terms of what they need in terms of orientation. And this has been very interesting, very rich. Another aspect is to adapt an explicit classification that disencourages ultra process, and in the case of them, the non consumption. And another is to talk about homemade cooking in a more structured way with ample focus. As regard diffusion, we had inspiring examples. And another important thing of those who opinion makers, influencers, communicators, teachers. And another important thing, besides the messages themselves that the guides bring, is to develop strategies to promote how to establish these, like a web series, for example, and a web series that on short episode talks about day-to-day cooking and brings a lot of reflection, very objective in how to do it in the day-to-day. And I'll put this web series here, and it talks about the guide in one of 21 episodes. But and the guide to make these realities is to translate how to make the guide happen with many different messages. And then one thing that is very important when we talk about advertising these guidelines, we want that it be implemented in the practices of people and public policies. We cannot lose the sight that public policies, not only in terms of offering healthy food in the schools, for example, but public policies that help supply at fairer prices and good quality in all the neighborhoods. But all of this regulatory about labeling, ultra processed being taxed, and the regulatory agency agenda in terms of regulation. I think that's how to make the guidelines effective. So the idea of advertising and implementation has to go beyond these formal messages, but the idea that they will change the context in which people are living so that these healthy options be easier. That's it. Thank you.
Thank you, Ines. Before going towards the next activity, I just want, well, there was another comment from Marcia with regards to the guidelines. Well, here in Brazil, we have some assessments, and I will bring an example of, well, before the update of this guide with the children's guide that we had in 2002. There are studies in from Rio Grande do Sul in the south of Brazil that have assessed the impact on how the guide is used by health professionals. There's randomized field assays that shows that when the professionals, when they teach the families on complementary feeding, it is possible to have impacts. The children were breastfed for longer, had less cavities, less use of drugs. So there's a series of evidences that yes, that allow us to state that when the messages of the guides are incorporated by professional health professionals and educational professionals, it is possible to see positive impact in the lives of the children, the health of children. Those are studies that were held in Brazil that show this benefit. And it's important to highlight that not only the 12 months, but the 4 years, 6 years of age, showing that the two first years of life, they have a great potential to create healthy habits. And this tends to last for a long time afterwards. So one of the biggest work in our network is to try and systematize what already exists. basically showing the positive impacts of the implementation of the guides from the moment they are implemented. And another question that we've had is how to implement those guides in the context of scarcity of food. What those studies have shown us, well, here in Brazil, we have an explicit message is not to feed ultra processed food to children below 2 years of age. And the studies that I have mentioned, the families were guided into not providing this type of food. So this guidance of not providing that doesn't have any economic impact to the families because in fact, the family will stop buying those products and prioritize other types of foods. So in the studies that we've had in the an unfavorable socioeconomic study concept, it was possible to notice that the families prioritized in natura and minimally processed foods and avoiding the ultra processed one. Professor Carlos is here, but the Brazilian data that base the elaboration of this dietary guide have shown that in Brazil, both for the lower income as well as the higher income, it is possible to have minimally processed foods as the standard. And at the same time, we have projections for Brazil that if nothing is done in the near future, the ultra processed foods will be much cheaper than the consumption of fresh foods. So that's why it's important to have this set of actions. And this is a very wide debate that certainly many of you would have a lot to contribute. And will be left for a future moment. Now, I'd like to pass the floor to the MC that will tell us what's going to happen next. Thank you, Dr. Zara, for uh, your lead in this debate. Well, to talk about the food guides as inductors of healthy and sustainable habits, we'd like to invite Dr. Yanori Hernandez Carvanto, representative from FAO.
Muy buenos días a todos y a todas.
Good morning to all of you. Good afternoon.
Todavía estamos en buenos días por
I
toda
believe
Latinoamérica.
it's good morning for most of Latin America.
Brasil están las 2:30.
Oh yeah, Brazil. It's already it's almost 1 p.m. So thank you for your invitation. For us, FAO at FAO is an honor to be able to share with each one of you with this exchange of experiences in all of these processes that we've had the privilege of reaching or allowing to work closely with this dietary guidelines and, and everything that has been shown in level of implementation. So today, basically, as it was mentioned, the theme is to see how the dietary guides that we've had many important innovations, how we'll see what we can't leave aside. And especially last week, there was the Food System Summit, how they are inductors of these healthy and sustainable food systems. So I'll structure my presentation with an introduction, and and I will present you a new